Alright, what's going on, you guys? So as you guys know, a couple months ago I posted a video saying that I had shoulder impingement syndrome, and I was talking about my shoulder hurting and all that stuff. So in this video I kind of wanted to make a video to help people figure out whether or not they have shoulder impingement syndrome themselves, and kind of just a simple way to diagnose it. Um, I'm not a doctor and I'm not a physical therapist, I'm not a medical professional, but this is the way that I diagnosed mine, and it happened to be correct. And the rehab procedures and protocols that I followed happened to help and happened to work and happened to bring me back to 100%. So basically, I'm just going to run through how I figured out that I had it and how I brought it about. So if you're having shoulder pain, that's going to be obviously one of the first indicators that shoulder impingement is a possibility. One thing to consider when you get your shoulder pain, do you work out? Obviously, a lot of you watching this video are going to be people who work out, go to the gym, bodybuilders, powerlifters, etc. And what kind of workouts are you doing? One of the leading causes of shoulder impingement syndrome is going to be excessive pressing movement. So excessive bench press, excessively heavy bench presses, excessive military presses, excessive dips, excessive curls, even that front movement of your shoulder. Heavy curls and excessive curls with a barbell can cause shoulder impingement. So you need to consider whether you're doing those things or not. And I was doing all of those things. I was doing heavy bench 3 times a week, military presses on all of those bench days. I was doing, I compete and do the curl thing. So I was curling, at least 150 pounds, at least 2 days a week, sometimes going up to 160. When I would do my cheat form, I would go up to 170 on the curl. So, those things were things that contributed to my shoulder impingement. So some of the things that, I had to figure out were, a lot of range of motion stuff. So when I figured out that my shoulder was bad and it wasn't a normal after workout type of sore shoulder, what I did was, when I went to sleep, I was laying on the side that my shoulder hurt on, and I couldn't sleep. It hurt so bad. And the next day when I got a shower, it hurt so bad trying to raise my arm to this point that I couldn't wash my hair. I couldn't dry my hair because I couldn't fucking raise my arm past parallel with the ground. So that's one of the biggest tests that are there, that are available online, and pretty obvious things. If you lift your arm here and you've got pain towards the front of your shoulder, what the exact spot is where your trap meets your shoulder. There's going to be a little knob. You can feel a little bony protuberance right where your trap meets your shoulder. And when you lift your shoulder to parallel or above parallel or over your head, that's where you're going to feel the pain, is where this little bony knob is right here. So that's the first indicator that it's shoulder impingement syndrome, is the pain where that knob is. Obviously one of the first things is, if it doesn't go away after 2 to 3 days, then it's probably something other than just your basic soreness after a workout. So any lifting of your arm to parallel or above, whether that be to the side or to the front, and if you can't perform daily activities such as cleaning, washing your hair, or whatever you would do where you raise your arm, it's probably going to be shoulder impingement. So the things you need to consider are really what kind of workouts you're doing. Are they workouts that are going to affect your rotator cuff? Are they things that could possibly give you shoulder impingement? Are you doing these things every day? Are you doing these things excessively? Are you doing things that could contribute to shoulder impingement? And then also, where's the pain on your shoulder? What range of motion do you have with your shoulder? Where does your shoulder hurt? Stuff like that. Like I said, I looked all this stuff up. And that's kind of how I found out what I had, and then I had to do a little bit more research to find out how to treat it. So that's something you guys can watch in my next video. I've got a really good video coming up on the rehab protocols and the rehab exercises to do to treat shoulder impingement, and I feel like I put a lot of thought into that video, and I think that video is going to be really helpful to a lot of you guys that are looking to see how to get rid of the shoulder impingement. It took me about 3 or 4 months to finally get over it. As you're going to see in this video. So a lot of you guys that are watching this out there that you're experiencing some shoulder pain, you're probably Googling shoulder pain, workout injuries. You're probably Googling YouTube and searching for stuff like that. I'm here to tell you that one of the most common injuries amongst lifters is shoulder impingement syndrome. I'm just telling you some of the signs, some of the symptoms, trying to help you diagnose it, trying to help you guys figure this stuff out, because it took me a while to figure it out. So I'm just here to help, guys. I hope this helped you out, and hopefully you guys watch my next video. I'll be posting it here soon about how to rehab yourself from shoulder impingement. So thanks for watching, guys.